Hi, I'm talking today to Dr. Tariq Ahmad. Dr. Ahmad is a UK reconstructive and plastic surgeon. Hi, Dr. Ahmad.
Hi, nice to talk to you.
Thank you. Wonderful to be talking to you today on Askimo TV. Dr. Ahmad, today we're going to be discussing skin grafts and how they work. So let's start off with, what is skin grafting?
Well, it's simplicity. It's taking skin from one part of your body, very rarely somebody else's body, to replace tissue or skin that's been lost somewhere else.
What are some of the different types of skin grafts that you can get?
Okay, when you take skin, you can either take the full thickness of the skin, which gets you a much thicker graft, but it may be harder for it to take. And skin grafts take by joining up of blood vessels from where you place them into the graft itself. Much like if you take a plant, take cutting, and you bury, you put it under the ground, new roots will have to grow to nourish that graft. Same thing with human tissue. But you can also take partial thickness of the skin, which is much thinner, but heals much more easily. There's also composite grafts that are taking more than one type of tissue. They may include skin and cartilage, skin and muscle and so on. All these are different types of grafts. And today, we're beginning to see the advent of artificial grafts, or for example, dermis substitutes at the part of the skin that can help in giving improved quality of skin graft take. Skin grafts themselves may just be simple, or if you need to have more skin than you actually can take, you can do things like mesh it like a string vest and expand it, which means you get more skin graft than you actually take. You can have 2-for-1, 3-for-1, as much as 6-for-1 ratios. And that is important when you have a shortage of skin, for example, when you need to have skin for a big burn. The meshing also gives you a texture to the quality of the graft that sometimes can be helpful.
What would be some of the reasons, other than, let's say, a burn victim, that a person may require a skin graft?
Again, the main reasons why we use skin grafts is usually trauma, and that the most common trauma is burn injury. But if you've lost tissue in an accident, again, you may need a graft or a skin graft. But and the other main reason is cancer. When you remove cancer and create a defect, you made a skin graft to reconstruct that defect.
Tell me a little bit about the procedure or techniques used in actually doing the skin graft.
Obviously, you have to decide the choice of where the skin graft is going to be taken, and that depends on how severe or significant a graft you need. With large burns, you need to take a lot of skin, and therefore you can take skin from anywhere in the body, including from the scalp, from the breast, anywhere you can take it from. Scalp skin grafts are often the best in terms of color match for the face, when you're doing burns there. But when you're taking the graft, if you're taking a split thickness skin graft, then there are special graft knives that take different thicknesses of skin, a little bit like shish kebab. Or doner kebab, and you shave a very even layer of tissue, but you haven't taken the full skin, so what's left will heal in 7 to 10 days, 14 days. When it's healed, if you really need to, you can take the skin again. When you're taking full thickness skin grafts, however, you're taking the whole thickness of the skin, so it won't heal underneath, so that defect has to be stitched back together, or you need another graft to replace the donor defect where you take the skin from for the first operative site. In terms of healing and take of the graft, you obviously have to have a very good bed into which to place the graft, because when you're taking the skin graft, it's hanging free in the air, it has no blood supply. So it needs to be stuck onto a good bed that has a good, healthy blood supply to re-establish the circulation in that skin graft. The problems that you will get that will prevent that skin graft from taking are to do with movement or shearing while that graft is healing, infection or bleeding that will get in the way of that graft taking. So we take a lot of care in securing the graft well, either with fine sutures or staples, sometimes glue, or very special compression type dressings that allow that graft to cement itself into the bed and heal well. Of course, you also need to rest the part. When I first started in plastic surgery, a skin graft on the leg, you might keep the patient on bed rest for 2 weeks. Today, you'll probably get them up the next day, so things have come a long way.
Thank you, Dr. Ahmad. Thank you so much for talking to me today.
My pleasure.